Please welcome my first guest, Dr. Ibardo Zambrano, who's a urologist with Novant Health Urology Partners in Wilmington. Dr. Zambrano, thank you so much for coming today.
Thank you for your invitation. I appreciate it.
Sure. I know how busy you are, so I'm going to make this really easy for you.
Okay.
So you can go back to work. So I always start with getting to know my guests a little more and letting our viewers know where you went to school and where you're from. Where did you grow up?
So I actually grew up in beautiful Medellin, Colombia, so South America. Good coffee, good people, fun places. So, but I was seeking for better educational opportunities. So I came to the States when I was 16 years old.
Really?
So I would say I finished my high school and my college in New York. But then I worked as a research technician and assistant at the National Institute of Health. I was very interested in medicine from the beginning.
Oh, that's awesome.
So I knew I was going to go to medical school. So I wanted to sort of be in the research sphere and get good, recommendations and be sure about sort of what the focus would have been once I would finish medical school. So I did spend some time in Bethesda at the National Institute of Health.
That's a pretty amazing background.
Yeah, and then so I did my medical school at the University of Pennsylvania in Philadelphia, and matched for urology there as well. So I was in Philadelphia for 9 years. And then I came down south because I met my wife during medical school, and she was from UNC Chapel Hill.
Oh.
So we ended up doing our post residency training in oncology at the University of North Carolina, Chapel Hill.
And she's a physician too.
And she is, yeah. She's a gynecology oncologist. She's also a surgeon.
Oh, wow.
So it will be cool because we'll be probably working together in some
that's
cases.
true.
Yeah. So she's
Especially
part
in
of
the
the center.
oncology piece, yeah.
Exactly. So
That's awesome. Well, we're really happy to have you here. We're glad that you chose Novant Health for your home. And it's going to be exciting for us. It's a great resource that we need. There's a shortage of urology here, and so
yes,
we're very happy to have you.
Us as well.
And what drew you to the coast? Is there something, do you have family here?
So not particularly coast, but North Carolina. We love the
see.
state, and we spent 3 years in Chapel Hill.
Oh, yes.
And my wife is originally from Pittsburgh, just outside of Chapel Hill. I'm a city person, city boy, but always appreciated the countryside and the ocean. So this was a great opportunity, and we knew we wanted to stay in the state. So we were pretty excited to find jobs. Both of us will be working with Novant in Wilmington.
Right.
So
It's a big facility.
yeah, big facility, and for cancer surgeons, great because the Zimmer Center, it's a very robust
the Zimmer Center.
Cancer institute, and they're really good connections with UNC. So what was exciting for us coming through our training and finding our first jobs was that we will have the opportunity to collaborate with UNC and other institutions, and there's this partnership that's being built in the process to do clinical trials here between Zimmer and UNC Lineberger Cancer Center. So we will be sort of part of that, and that's how, within our goals, short-term goals, is to figure out how to connect with UNC and bring good research down here to Wilmington.
Yeah, it's a win-win for everybody, but especially for our patients.
Yes.
Yeah. Well, I know that cancer surgery is a big part of what you do, and you do a lot of robotic surgery.
Yes.
So tell me what value the robotic surgery brings to a patient or to a physician.
Sure. I think, the big selling point about the robot is that it definitely decreases pain, postoperative pain. And also for a surgeon, you can use it in a way that you can basically see better and dissect their planes better, so you minimize blood loss. So it will be pain control after the surgeries and then minimize blood loss. So that translates into faster recovery. So usually, depending on the type of organ surgery that you have, so let's say in my field, kidney and prostate, or smaller tumors in the retroperitoneum, you can easily go home by next day. And that's because, that's because you just basically, pain it's very minimal. In general, you don't really need narcotics after robotic surgery.
That's great.
In general. And then, yes, blood loss is minimal, and smaller incisions too, so that affords faster recovery, so you can be home more comfortable rather than a hospital faster. So, and the outcomes are very similar, and what we care about is oncologic outcomes, so that we achieve negative margins, so that we remove the whole cancer. So, people who are against the robot, and I will say that's an older generation, they're always hesitant to
Really? You have to
adopt the
talk them into it
innovations.
sometimes?
But yeah, but I will say, at least in urology, it's widely used by now. So in 2022, I will say. At least the prostates, 95% of prostatectomies are done with the robotic platform. Kidneys, many of them, we can now, because we gotten really good at it, we can do more complex tumors and use the robot. And again, the goal in the robot is minimize pain and enhance recovery because you have very minimal blood loss.
I want to concentrate a little bit on prostate cancer.
Sure.
How prevalent is it?
Extremely. It's the most common cancer in men, and it's interesting because people don't really recognize that. There are myths about prostate cancer. So
Really?
it's very common. People decide not to. I don't know. There's a little bit of controversy about prostate cancers because the way we did screening before, and I'm referring to PSA, which stands for prostate-specific antigen. Basically, we didn't know how to really interpret those results well, and then we overused. How we're approaching diagnosis. So ended up being a lot of overdiagnosis and overtreatment. So so we sort of got a bad rep. So for a while, some of the non-surgical societies wouldn't really recommend PSA screening, like routine PSA screening. So we come to an agreement, and it's extremely important because it's the most common cancer in America for men, and it kills a lot of men as well. Luckily, most of the cancers are detected early, but that's why you have to be aware about PSA screening.
Yeah. Does it affect a certain age group? Or?
Yeah. So most people. So it's one of the myths is that it only affects older men. Almost true, not quite. Actually, about 35% of men will be under the age of 65, which I consider young.
That's young.
Yeah. So, and if it presents earlier and earlier, those tend to be more aggressive. So what we saw with the old PSA controversy and decrease in the use of PSA screening is that now we started to see more advanced disease in younger men. So it's known, it's a known effect from all this, controversy around PSA screening. So it's important to keep that in mind.
So you also treat bladder cancer?
Yes.
Tell me about that. What surgical procedures would you
So it all
do
depends how, the tumor itself is affecting the wall of the bladder. So we care about depth. So if it's superficial, it's not into the muscle wall. So the bladder has three basic layers of mucosa. That's the inner lining. Then you have your muscular layer, and then you have a fatty layer with fibrous tissue, and then that's it. So if it's affecting just the superficial, you can do that via endoscopic procedures where you just sort of scrape the bladder, and then depending on the pathology, we're looking for low-grade versus high-grade looking cells, so how aggressive cells look under the microscope. Then we would recommend doing intravesical treatments where you put an agent in the bladder, like a chemotherapy or a like, to minimize the risk of recurrence. If it's into the muscle, then unfortunately the bladder has to be removed because once it's at the muscle, it can get out and metastasize very easily. So you need very major surgery. Well, you have to remove the bladder.
I wanted to touch on renal cancer before
Sure.
we run out of time. Tell me about how you treat.
Yeah, so it all depends. So nowadays we find a lot of renal cancers because of CT scans. Everybody goes to the ED for, abdominal pain, gets a CT scan.
Yeah.
You fell, minor bruise, CT scan.
Yeah.
So it's very overused in the U.S. So now we're finding all these small renal masses.
Oh.
In general, they tend to not be aggressive cancers when they're that small. Maybe 20% of them will actually be benign. So people really freak out about these small renal tumors. So if they're small, active surveillance, basically you do serial scans is one of the approaches. Depending on the size, then we actually recommend removing, but we don't have to lose the kidney. Now with the robot, for example, we're able to partially do a partial resection of the kidney where you only take the tumor and save as much kidney parenchyma as you can. So,
That's amazing.
So we can do a lot with the robot, but if it's a big tumor in the kidney, then the kidney unfortunately has to be removed. So it all depends.
But you have two of them, right?
Yeah, but you have two of them, exactly.
I shouldn't have said that. But yeah, that's great news that you can do partials and you could live a long and productive life with 1 or 1.5 kidneys.
Yeah, I would say you only need about half a kidney.
Really? Well, that's good to know.
Yeah. So there's room for having some surgeries.
Well, it's been such a pleasure having you. I hope you'll come back because I think there's just so many more questions I have to ask you that we would love to have you as our guest again.
Oh, thank you. Yeah, I'll be very glad to come back.
All
and
right.
chat,
Well,
so.
thank you so much for being here. We enjoyed getting to know you and hope to see you soon.
We'll do. Take care. Thank you.
Thank you.